Welcome back. This lecture is on pulmonary heart disease, also known as cor pulmonale. When we say cor pulmonale, it's a condition in which the right ventricle of the heart enlarges. It can result with a right-sided heart failure or without a right-sided heart failure. Any disease affecting the lungs and is accompanied by hypoxemia or decreased levels of oxygen in the blood may result in cor pulmonale. Pulmonary hypertension or increased blood pressure in the lungs is the most common cause of cor pulmonale. Other causes include chronic lung diseases, which leads to decreased oxygen levels in the blood, chronic obstructive pulmonary disease, pulmonary embolus or blood clots in the lungs, cystic fibrosis, scarring of the lungs or condition that leads to scarring of the lungs and the lung tissue, obstructive sleep apnea, which causes stops or cessation of breathing because of airflow limitation or airway blockage or inflammation, and also when there is a massive obesity or in obese people. Cor pulmonale or right-sided heart failure is an enlargement of the right ventricle due to high blood pressure in the lungs, and is usually caused by chronic lung diseases. And when it results, it leads to dilatation or stretching of the muscles of the heart, and subsequently leading to hypertrophy or overgrowth of the cells. When there is a condition that causes chronic or long-term deprivation of oxygen to the lungs, which results in hypoxemia or decreased oxygen levels in the blood, and also high carbon dioxide levels in the blood, it leads to or results in ventilatory insufficiency. Hypoxemia and hypercapnia causes pulmonary arterial vasoconstriction. When there is a decreased oxygen levels in the blood and an increased carbon dioxide, it causes the blood vessels to constrict and possibly reduces pulmonary vascular bed. That is what happens in emphysema or pulmonary embolism. Cor pulmonale results from pulmonary hypertension or when there is an increased pressure in the lungs, which causes the right side of the heart to enlarge. When it enlarges, there is an increased work required for the blood to pump against a high resistance through the vascular system, and this leads to pulmonary circulatory system failure. Clinical features depends on the underlying cause of the disease. If it's COPD or chronic obstructive pulmonary disease, it has symptoms including that of COPD. With right-sided ventricular failure, the patient may develop increasing edema of the feet because the heart is unable to pump adequate blood to circulation. And there will be distended neck veins. There will be enlarged palpable liver. Ascites or fluid will accumulate in the abdominal cavity, and there will be heart murmurs as well. When there is increased carbon dioxide in the blood, it can lead to symptoms like headache and confusion. Patients may also complain of shortness of breath, cough, wheezing, and fatigue or tiredness. In order to diagnose patients with cor pulmonale, physical examination is key. Patients with cor pulmonale, upon physical examination, will review abnormal heart murmurs or heart rhythms. You will also see fluid retention as in edema and ascites, and there will be also protruding neck veins. When checked, brain natriuretic peptide, which is an amino acid in the heart, will be secreted when the heart is stressed, so they will be high. CT scans can also be done, including echocardiogram, which will show a right-sided heart enlargement. Chest X-rays can also show enlargement, and also when you want to see if it's pulmonary embolus, lung scan can be done to detect clots. Lung function can also be done or checked to see how well the lung is functioning, and may show airway obstruction as well. Arterial blood gases can be done to look out for decreased partial pressure of oxygen and an increased partial pressure of carbon dioxide, and also check the pH level as well. In rare cases, lung biopsy can be done to see if there are underlying damages to the lungs. In managing cor pulmonale, administration of bronchodilators is necessary. Example is ipratropium bromide. Pulmonary vasodilators, example is nitroprusside, can also be administered, including hydralazine. Supplemental oxygen is important to help to improve gas exchange and also reduce pulmonary pressure. Chest physical therapy and bronchial hygiene maneuvers can help to remove accumulated secretions, and also you have to ensure bed rest. Sodium restriction is important because of the edema, and also diuretic therapy to help to reduce the peripheral edema as well. This is all on cor pulmonale. Thank you for watching.